So AFib is a problem that increases the risk of stroke and heart failure. So stroke prevention is the number one priority, because that's probably the worst things that can happen to the patient. Prevention of stroke with blood thinner still remain an important priority, and that's something that everybody should always consider. I think what we learned in a large study that was presented at the European Heart Meeting last September is that the sooner we intervene to maintain sinus rhythm, the better it is for the patient, because that affects their mortality and risk of cardiovascular problems. So we learned that it's important to do that. We have to educate the community, because this is something that not necessarily even cardiology practice consistently, but now we have good large studies supporting this strategy. And early on, many patients came to look for care too late, both patients with stroke, heart attack, and even with arrhythmia. And with arrhythmia, in some way, we can always mend, trying to kind of find solution. But with heart attack and stroke, sometimes it was a little late. Some people die because of that, or some people have damage that put them in a group that's not going to have a nice life down the road. So we learned the hard way that the fear that the pandemic created at the beginning really didn't do much good, and so we struggle as a healthcare professional to make sure that the patient knew that they should not delay coming to the hospital. Now most of the staff is vaccinated. We still test the patient before the procedure, because we want to make sure that they are in a good place before they have a procedure. So I would say don't worry about is probably more dangerous to stay home and continue to suffer rather than coming to the hospital. So it's very important that they trust the medical community that they were doing the right things to continue to do this procedure in a safe way.